Thank you for being here on this edition of Healthy Hydration at Home. Today we have Andy Stasko, who is my father. And could you just give the viewers a little overview of your background and what you do professionally for a living?
Well, thank you for having me and thank you for the invitation. Looking forward to our conversation. Yes, I'm a cardiac perfusionist, and as a perfusionist, you work in the operating room, driving the heart-lung bypass machine, what we know as cardiopulmonary bypass. And we essentially the heart of the operation. We're the people behind the scenes that support the heart, lungs, kidneys, while the heart surgeon works on a muscle.
So would you say in perfusion services, you interact with hydration at any point?
Well, perfusion moves blood, and blood is the medium, and that we are the artist. So the blood moves around the body, and we perfuse the organs. And one of the largest components of the vascular space that we move is plasma, and the largest component of plasma is the electrolytes and the elements of non-cellular fluid movement. So hydration is an absolute critical element.
How would you say that the immune system plays into pre-op, during op, or post-op recovery? And do you guys control that, or do you look at that variable at all?
Exactly. Yes, we do. And hydration and immunity is a key element in the preoperative pre-op workup. So hydration is a key component, and immunity. We realized in medicine that 80% of our body's immune is in the gut. So 80% of your immune system in preparation of surgery is fueled by hydration. So if you can fuel your gut, keep your body as tuned up as possible, and you're given all of this pre-op medication and information, that is such an important part for your intra-op and post-operative course.
We understand that you are on the front lines with the COVID-19 SARS-CoV-2 outbreak here in Denver, Colorado. Can you speak to your experience with that? Just how it's been, what it's been like, what you've been doing, and all that?
Yes, you're correct. I am one of the clinical staff in one of the Denver facilities that support COVID positive patients. Specifically, those patients, we've had a number of them where we've placed them on what is known as ECMO, which stands for extracorporeal membrane oxygenation. It's a miniaturized version of the bypass machine in an ICU setting where their blood flow goes in and out of the body. We oxygenate it, scrub off the carbon dioxide, regulate their temperature. So we support their body while their lungs are trying to heal and recover. One gentleman was a marathon runner, got ill. His wife is a nurse epidemiologist, and she was watching his health deteriorate very quickly. And he woke up when he was leaving the hospital, essentially realizing that he had no idea of the previous 14 days. We put him on ECMO. He managed to survive through that gauntlet of care, and he left the hospital a joyous, happy man. He's back running 6 miles a day again. We're seeing lung disease overwhelming the body, and the ECMO support was needed to kind of pull them out of the clutches of death. It's very scary because we didn't know that much about it in the beginning. It's much more tolerable now because we have the protective equipment. We are aware of how it gets into our body. We as clinicians have to have hydration. We have to sleep. We have to have good immunity. We have to be as in the top of our game when we're managing patients in the intensive care to protect ourselves and to protect our families so that we can treat these patients. It was quite a scary feeling and extremely nerve-wracking walking into an environment knowing you're making a difference in someone's care, but you're not knowing if you're going to come home with this hitchhiker in your body or not. And it was an extremely scary time because of availability of personal protective equipment, what we know as PPE, and the shields that you need to prevent that bug from getting inside of you. But we now know that we're doing our absolute best to keep us safe and the public safe, as well as take care of patients.
So as a clinician who works in this environment, would you have any advice for those type of people who are getting back to work?
What we now learn is this is an airborne droplet carried hitchhiker. So put the mask on and put social distancing distance between you and that potentially infected person, but please put a barrier between you and your workforce, put distance between, and wash your hands. If there are signs and symptoms and you're the healthcare worker, you're the person going to work, and you start to develop things that are already listed on the CDC, get your temperature checked and get the COVID test.
Awesome. So would you say, just to finish up here, would you say that when you're not at work and you are at home, is there anything you can do to boost your immune system and improve your ability to fight infection, whether it be COVID or just a common cold?
Yes, you can. Hydration is a key element to gut immunity. Hydration is essential to moving nutrition around the body. Good rest, good nutrition, hydrate. Water is healthy, and then all of the other product lines that are available. But hydration really makes the key to move blood and nutrition around your body.
Perfect. Thank you so much for all your information and your inside knowledge on what's going on the front lines. And I think our viewers and listeners will very much appreciate the first person perspective.